Daniel's in excruciating pain and can't bear to look at the damage he's done. Tom doesn't know if Daniel has cut an artery or is in danger of losing any fingers.
Okay, all right, bud.
30-year-old bricklayer Daniel was cutting the timber on a workbench using an angle grinder with a 4.5-inch circular blade when he lost control and it sliced through his right hand. His wife Stacey found him and has been trying to stop the bleeding.
Okay, and how bad is it before we have a look at it? Is it pretty bad? Okay.
He hasn't seen it.
Okay, what's your name, sir?
Daniel.
Daniel. Do you live here, do you? Is this right? Okay.
Yeah.
The paramedics have been on scene for 5 minutes. Daniel is in a severe state of shock and close to passing out. They've got him to raise his arm above his heart to try and stop the bleeding.
It's fine. Have you got your trauma pack with you, Tom?
No, I can go.
Yeah, I think maybe if you're saying it's quite bad, we'll get our bandages just in case. If you hurt yourself anywhere else?
No.
No, so it's just your hand?
Yeah.
Okay. Do you mind if I...
Yeah.
This impressive towel you got on here.
It's the second one.
Okay. Okay, so what we'll do, before we open it up, we'll get our bandages just in case. All right. Are you all right to come round here and cut his sleeve off?
Yeah.
I've got some scissors on me, if you want. Yeah. So quick. Okay. I know, sorry, buddy. We'll give you some pain relief, but what I want to do is have a real quick look at it first.
Until he can actually see the wound, Tom doesn't know if Daniel has cut an artery or is in danger of losing any fingers. Both require immediate surgery.
Okay, all right, bud. Turn your arm round. All right. You feel me touching you here? Okay.
Daniel has a 3-inch wound, 1.5 inches deep between his thumb and forefinger. Once the towel is removed, it starts bleeding freely again.
Wiggle that thumb for me.
Can't.
Okay, all right. What we're going to do, buddy, is we're going to clean it up. It's in the corner bit of your thumb. That make you obviously know where it is.
Lucky for Daniel, the blade stopped short of the bone.
Straighten that arm out for me. I'm sorry. Well done. I just want to straighten this hand for me.
Daniel is fortunate. All his fingers are still there, and there's no obvious nerve damage. The wound will now be cleaned with saline solution and dressed to immobilize the fingers and help stop the bleeding.
It's just obviously in the crease of his thumb. He's got good circulation here. Yeah, and he can feel me touching his hands.
Yeah.
And it's, yeah, so I think it's just more soft tissue.
Yeah.
We're going to cover it.
Yep.
And then I think we'll...
If we just take a picture? So
Yeah, that's fine.
One of the paramedics takes photographs of the wound to show to the hospital doctors in A&E so they can assess whether he needs immediate surgery.
Nice and still.
All right. Keep still for us, buddy. As soon as you've done this, we'll get you some pain relief.
Last year, almost 5,000 people were admitted to hospital following accidents with power tools.
We're going to bandage that up. It's going to be a little bit painful for a little while.
I'm sorry, mate. When you're working next, don't say Monday.
Yeah. He won't be.
I think it probably feels and looks worse than what it is.
Yeah.
I think it needs to be cleaned, it needs to be x-rayed,
Yeah.
and it needs to be stitched back together.
Cheers for that. I don't know how you lot could look at it, to be fair.
That's all right, mate. There you go. Just take your time, nice and slow. We're in no rush. Feel all right? Let me just walk behind you.
With Daniel now recovered enough to walk out to the ambulance, Tom is happy to leave him in the care of the local crew for the journey to hospital.
He'll go to the local A&E where he'll get it cleaned. He most likely will have some form of antibiotics and an x-ray, and then it'll be decided onto there if he needs specialist care to treat that part of his hand. It's very much in the forefront of our minds that we want him to get the best care for his hand. So he's a young chap, he's a labourer. We obviously need to get him back to work as soon as possible. It could have been a lot worse. It's still going to be a really painful injury, but hopefully he'll have a really quick recovery.
"84-year-old Ron was found face down in his garden pond. It usually takes less than 10 minutes underwater to die from drowning. By the time Tom and Faye arrive, the paramedics have managed to get Ron out of his pond.
Got a head injury to the left side of his head.
But no one's sure how long he was submerged.
So we got a temperature and a BM.
Temperature we do, it's low. BM is 6.3.
Now in level 3 PPE, Tom and Faye can lead the efforts to resuscitate him.
Check, let's put carotid pulse, femoral pulse, anything?
No, not on mine.
Nothing, let's get back on his chest then, thank you.
He's not breathing, and his heart has stopped.
Do you mind if we swap?
Ron's wife says he went to feed his fish, and she found him 15 minutes later.
And then what's your name, sorry? Amy. I'm Tom, and that's Faye. So I can't feel any pulse. So if we could just give some more fluid, and yeah, if you want to carry on with some CPR.
Tom and Faye need to get oxygen back into Ron's vital organs. They're using chest compressions to pump the blood,
Is it all right if you could get some fluids up and just start pushing that through?
while administering fluids intravenously to increase his blood pressure.
You got another bag of fluid?
Another one.
Another one, yeah. Thank you.
Okay, so just the BG, please.
They must also intubate him by inserting a tube down his throat to clear his airway so they can mechanically control his breathing.
He's just got quite a long anterior, so you just need to probably put something.
Do you want something under his head?
Yeah, you just need something under his throat. Okay,
Oh, that'll do.
thank you. And then just give us a couple of squeezes on that. Okay, let's try again. Okay, cuff up. Okay, so Faye, I'm just going to talk out loud. We've got it at 23 at the teeth,
Yeah.
we've got misting of the tube, and we've got an end tidal of 8.6 at the moment.
Let's just take a
So-
screenshot of that with your other hand, Tom.
The monitor shows the CPR's working and oxygen's returning to Ron's blood.
And when's our next pulse check? Is it about now?
You're about now.
20 seconds, okay.
But Tom and Faye still need to get his heart to restart.
Pulse check, let's go for the femoral. Right. I can't feel it.
Nothing, no pulse. Okay, so carry on with some CPR.
Although he doesn't yet have a pulse, a strong end tidal reading shows Ron's lungs are successfully absorbing air and oxygen is returning to his body.
You're doing some CPR and we'll get to rotate someone shortly.
We'll put the Lucas on in his
Yeah,
exercise.
so I think our next plan, if everyone's happy, is we'll attack the Lucas. Okay, so we'll just get you to stop CPR for a second.
The Lucas machine is a device which can mechanically apply chest compressions. Like manual CPR, it keeps blood flowing around the body until the heart can restart.
Let's try and get another cannula in as well, if you wouldn't mind, and then we can get into this. But again, we get some warm drugs in him, if you can pop it in that one.
I've got a temperature probe. We're going to use our monitor to get an actual accurate reading of his temperature as well.
As Ron's body temperature is very low,
There's fluid through there, and that's, you're happy to connect that up.
Faye begins administering fluids which are passed through a heater to try to warm him up.
So we've got 2 bags of fluid running through now, one through a warmer. So we're reversing everything we can.
So Faye, we've got a temperature of 30.7.
Tom and Faye are steadily reversing the effects of Ron being submerged in the pond.
So let's just do a quick pulse check. So I think I just saw something in his abdomen. It's feeling quite warm. I think I've got a femoral here.
I haven't got a carotid.
You know?
No.
It's really weak.
Although Tom felt a weak femoral pulse in Ron's groin, that's now gone.
We've definitely got a pulse-producing rhythm, a good rate of about 100 PA.
But the team's monitors are picking up an electrical signal, a sign that the heart is still partly functioning.
So my thoughts are we look to probably convey him.
We need another adrenaline.
Okay. And then we'll get a scoop. We'll go from there, I think.
Tom and Faye are hopeful that Ron can be resuscitated.
We'll get one of you to hold the fluids, if that's all right.
Yeah, that's fine.
Can you help your colleague with a scoop?
But they've done all they can on site.
Amy, you're going to stay ventilating him, and then we'll look just to carry him straight across, if that's all right.
They now want to get him to hospital as quickly as possible.
Okay, so we're going to go to the QE. We're going to leave in the next minute if everyone's ready. He's currently got a core temperature of 30 degrees with a normal BM. Considering these factors, we're conveying to QE with an ETA of 8 minutes, 8 minutes.
Should we just put something under his head as well? Because his head looks very hyperflexed.
A short while later, the ambulance arrives at Birmingham's Queen Elizabeth Hospital.
So Dan, are you right to grab the monitor?
I'll grab the monitor, that's all right.
Here, a specialist cardiac team will continue efforts to resuscitate Ron.
Even though he was in cardiac arrest, there was indications that his heart was beating with the ECG, and the fact that we were warming and improving his current situation kind of suggested that we might have got a pulse back, and that's why we made that decision to take him to hospital.
Arriving at the crash site, the ambulance crew have managed to get the man out of the badly wrecked car. The dashboard is completely crushed and the horn still blaring. A large group of passers-by have gathered.
Line across the car, GCS3. Okay. So we've ripped tonight. Cheers. Got a massive heading. Right, okay, yeah. Okay, cool.
The 38-year-old man was driving back from seeing a friend when his car left the road and hit a wall.
Thanks for your help, guys. Just move that way.
He is completely unresponsive. He has a hole in his skull and his brain is exposed.
Don't worry about the collar, guys. We're gonna put a tube down him and go from there. Cool. We're gonna do after drugs and yeah, cool.
The man's breathing is so faint, his heart could stop at any moment. Mark's only option to try and stabilise him is to put him into an induced coma so he can take over his breathing.
From our point of view, we can do it here. I think we've got enough space here, haven't we?
Yeah, we do it here and then...
As they prepare to perform this major life-saving intervention,
Guys, is there... I know he's got the wound on the one side of his head, but there's nothing on the other side, is there? No. Mark, they nearly got him strapped on, so we might as well just lift him up onto the...
Yeah, absolutely fine.
Mark and Colin know it's down to them and the crew to get him to hospital alive.
I'm going to do ketamine, sucks, and some rock afterwards, and then we can go from there. And he's pretty fast at the moment. We're going to be literally going straight up there, and then we're going to put a tube down him and go from there.
The patient could die at any moment, so Mark, a consultant anaesthetist at University Hospital North Midlands, is going to place him in a medically induced coma so they can control his breathing and protect the vital supply of oxygen to his brain and organs.
Oh, you got the VL?
Yeah, it's all ready.
I'm just going to do a mental check through. So scope, yeah. Tube, you got a bit of gel in it? I just need a bit of syringe in the end.
With the help of one of the bystanders, an off-duty paramedic, the crew lift the man onto the stretcher to carry out the procedure which is normally performed in a hospital.
Get more free. Hold on, just take. Left foot. Let's have a look at his eyes.
In the dark, by the side of the road, Mark can't afford to make any mistakes. So before he administers the powerful drugs, he checks to see if there's been any change in his condition.
Definitely eyes one, verbal one, and then it's just motor is varying. As if anything, he's doing abnormal flexion, isn't he? Right, monitor wise, just want to look at the monitor. So let's run back on. So we've got ECG on. I'm about to try and do blood pressure again because we've not really seen one at all.
He's a bit cold, isn't he, unfortunately?
Just doing a blood pressure at the moment.
The man's condition is deteriorating. He has an irregular heartbeat and low blood pressure.
I think we're going to have to work pragmatically on what we've got, Cole. Right, it's struggling with the erratic rates. He's going to do something very strange with us in a minute, Cole.
Yeah.
He could go into cardiac arrest at any moment. They need to act fast.
Guys, for those of you who haven't seen him before, in a minute he's going to have a bit of a twitch as the paralysis kicks in. I'm going to pop the tube down. Okay. Right, ready. Time check. You happy, Cole?
Yeah.
Yep. Quarter to. Yep, quarter to. Yeah, I think everything is very cold. It's a heart. Right, this is going to be a token 50.
The dose of Sux will take a minute to take effect. As the drugs kick in, the muscles in the man's arms convulse. He is now completely paralysed, unable to even breathe for himself.
Okay, all yours.
Colin now has 5 minutes to get the breathing tube in place and start ventilating him, otherwise he will die.
Okay, Bougie's through. Yeah, ready for the tube?
The effect of the paralysing drugs lasts for less than 30 minutes, so it will need constant monitoring to avoid any conflict between his body's natural breathing and the ventilator.
Just hold the tube for me, mate. We'll go with 820 at the teeth.
Okay, got the tube. Yep, tube. Bougie.
Colin will squeeze air into his lungs manually until he can be attached to the ventilator.
So let's start keeping the warmth in if we can do. Suction can come away.
Yes.
So we're happy airway secure, we're breathing nicely.
We are.
Okay, Sats are still very erratic. I don't think we can make any comment on that at the moment, it's too cold.
Right, we'll get him on the ventilator as soon as he's in the back of the ambulance then.
Well, how far is it to QE from here?
20 minutes.
Mark and Colin will travel with the patient to provide critical care throughout the journey.
So he's got a traumatic brain injury, so we have to presume he's bleeding in his brain. So he's now been RSI'd.
Mark administers another dose of the muscle relaxant combined with a sedative.
At this moment in time, we don't want him to be straining against any of what we're doing. We just want to keep it nice and steady and flat. The numbers we've got on the screen are perfect for us at the moment, and so if we can keep him just the way he is until we get to hospital, then that's better for us, better for the patient. They can then reassess. Once they've got the scan, they can make a decision what they're going to do after that.
Arriving at hospital, time is critical. The man is taken directly to the emergency doctors.
So by doing that early intervention, a good 45 minutes before he got to hospital, we hopefully helped stabilise him a bit and made a difference. And that is our bread and butter, to go to the sick patients, work with the crews on infrequent events for them, but frequent for us.
With a man run over by a 12-ton bus, the risk of catastrophic injuries is huge. So critical care paramedic Colin Apps is immediately dispatched. 12 minutes after receiving the call, Colin arrives and is briefed by the operations manager overseeing the incident.
He's just been trapped underneath this bus here.
Yeah.
His ankles were literally by his head.
Yeah.
This is as tight as you could get the bus.
Okay.
And we've literally just had to drag him out. It's literally full
Yes.
drum and half under.
GCS 15 still? But...
GCS 15, yeah.
And you don't think he looks very well?
Peeling, climbing from what we could see. We couldn't get any oxygen. We've literally just got him out.
Thankfully, just before Colin arrived, firefighters were able to free the man and he's now being assessed by paramedics.
Has he said he's got any pain anywhere?
In his arm. Where's your pain?
Guys, take his clothes off completely. Get full monitoring on him. We need an ECG on him so we can monitor his accurate heart rate. Yeah. All right?
We've got a blood pressure EFM.
Yeah, 101 over 69. Good radial as well.
44-year-old Andrew was travelling to meet his wife when he stepped out in front of the bus.
He needs the pelvic binder on. Yeah, because if he's bleeding, we need to stop him bleeding before we start replacing anything.
Although Andrew is conscious, Colin is concerned. If he's broken his pelvis, he could have life-threatening internal bleeding.
So he's got no bleeding under there, but his leg was, you say, quite up above his head, yeah?
By his head, yeah. It's kind of bent over onto this leg was above there.
As a catastrophic internal hemorrhage can cause death within 5 minutes, Andrew's in need of urgent transfer to a major trauma centre.
60, could you just update me? Is HeliMed en route over? Do you take any medicine for anything, Andrew? Epilepsy? Okay. You haven't had a fit at all, do you know of?
No. We'll get morphine on the truck if you guys are after it. Yeah.
Yeah, we'll just give us the IV paracetamol for now.
Paracetamol going in, guys.
Andrew, you still here?
Yeah.
Good man.
Colin is concerned he may have life-threatening internal injuries.
Can we grab another cream?
Andrew, where does it hurt?
Just that down, just feeling pretty shaky. In his shoulder. In your shoulder, is there?
So is it you had the TXA, or was that just being drawn up, yeah?
Colin gives Andrew tranexamic acid to help stop excessive bleeding.
Just chuck it over this side, I'll pop it on this side.
Although they've managed to stabilise Andrew, they need to get him to hospital fast.
7062, what's HeliMed's ETA now over?
Colin checks the whereabouts of the helicopter.
What do you think about leaving scene to the QE? And we'll just, because I don't think HeliMed's going to do anything extra now.
No, it's BP 91 over 60.
It's come up a little bit, so don't worry about the fluids for now. We'll do it on the way.
Rather than wait for the air ambulance, Colin and the crew decide it would be best if he escorts Andrew to hospital by road. A patient with internal injuries can suddenly deteriorate, so Colin's critical care continues throughout the 20-minute journey.
How's your pain now? Does it hurt anywhere? What happened? Do you remember?
At the Queen Elizabeth Hospital in Birmingham, Colin hands Andrew into the care of the emergency doctors.
Quite a serious job, especially in terms of the mechanism and potential a serious injury. I suspect he's injured something, I'm not sure what, which is why he's having a CT scan so he can find out. In terms of his observations, he didn't seem terrible, but I'm sure he's got something wrong with him.
In Birmingham, critical care paramedics Will Meadows and Colin Apps have been called to an accident on a building site.
Has been working on a building site, ground floor, just across the road from here. He's been using a plunge saw. Thought he had it all stable and reached underneath it, but it's still been going. It's dropped and gone through his arm.
Okay.
We've just got quite a deep laceration to the right forearm there.
Righto.
The blade has sliced open a deep 3-inch wide wound.
Have a clean bandage as well. Clean cut. Went quite grey. Was quite shocked from everything that happened originally. Had his legs raised on our arrival.
Rich was working alone when the mechanical saw caught in his coat and sliced through his arm. He ran outside to get help before collapsing unconscious in the street.
Got the first set of obs done now. Just got him inside, so so cold really.
Lovely,
so,
lovely.
Quite deep.
I think we have gone through some tendons or ligaments there, haven't we? But not much in the way of blood loss.
We're unsure. The towel that was wrapped round him disappeared once we were getting there. There was some blood in his left glove, so we're not sure exactly. There's no blood loss through the floor either.
Oh, well done.
If the blade has cut through muscles and tendons, there's a chance Rich could lose the use of his arm.
Do you think there is tendon damage?
It looks like it.
Have you got a good sensation in all your fingers?
Yeah, I can feel them all.
Can you move them well?
Pins and needles.
Do you feel like your grip is weak?
Do you feel sick at all?
A little bit.
A little.
Will phones control to update them on Rich's condition and discuss which hospital he should be sent to.
This saw has come down onto his the inside of his right forearm and sustained an isolated open laceration. It's quite deep. There's a lot of stiff adipose tissue, and it looks like there's possible tendon and ligament damage there as well. As he was sort of moving, you could see stuff moving in the forearm, if you know what I mean. We'll go with QE as his destination.
Rich's arm urgently needs to be assessed by a plastic surgeon, which means he will be blue lighted to the Queen Elizabeth Hospital Major Trauma Centre in Birmingham.
There was no sort of foreign bodies, debris or anything. It wasn't dirty, was it? It did look clean, didn't it? Yeah.
Rich's blood pressure and heart rate are returning to normal, so the ambulance crew can give him some pain relief with less risk of him passing out.
How much pain are you in?
Well, it's getting worse as it's go, like I'm calming down a bit.
Yeah. If you had to give the pain you're in a score, a mark out of 10, 10 being the worst pain.
I'd say maybe about a 6 or 7.
Oh.
22 minutes after they arrived on scene, Rich is ready to start the 5-mile journey to hospital.
Get that arm sorted, right?
Yes, guys, thank you for your help.
Satisfied with his progress, Will and Colin are happy to leave him in the care of the ambulance crew.